This video is meant to answer any questions you may have about your upcoming endovascular aneurysm repair, or EVAR. The term endovascular means inside blood vessels. The goal of endovascular aneurysm repair is to repair the aneurysm from within the blood vessel using a stent graft. This is placed into position with the assistance of X-ray technology. Aneurysms most commonly affect the aorta, which is the largest blood vessel in your body. It begins as the thoracic aorta in the chest, where it leaves the heart and travels through the diaphragm to become the abdominal aorta. It then gives off branches that supply circulation to your internal organs, and eventually the aorta divides into two vessels in the lower abdomen to become the iliac arteries, which supply circulation to your lower extremities. An aneurysm can be a result of a genetic predisposition or may occur spontaneously. Smoking and prolonged high blood pressure increase the rate of enlargement. Aneurysm surgery may be recommended to prevent the life-threatening rupture of an aneurysm that has increased to an unsafe size. The goal of endovascular aneurysm repair is to prevent rupture of the aneurysm while using minimally invasive repair techniques. During an endovascular aneurysm repair, you will receive general anesthesia, and a small surgical incision will be placed over the femoral arteries at the top of each leg. This allows the graft to be placed safely within the arteries for delivery into the aortic aneurysm. High-definition X-rays and contrast angiograms will appear on a monitor, allowing your surgeon to visualize the aorta and accurately position the endograft with minimal effect on other blood vessels that supply circulation to your kidneys and abdominal organs. When the positioning is appropriate, the graft will expand to fit snugly against the walls of the healthy aorta above and below the aneurysm.